In terms of the size of the private sector, there are 258 functional private facilities. 73% is located in Montserrat County, which is where Monrovia, the capital, is located. Primary level facilities make up the lion's share of the private health market at 88% of all facilities. There are 16 health centres, which is 7%, and 12 hospitals, which is 5%. In terms of family planning in urban areas, as you can see, just over half of private facilities offer family planning services, and 27% of clients state that they access family planning services from the private sector. In terms of the distribution of equity across facility types, the private sector is on the right-hand side of the bar chart you see here, and is generally wealth quintiles 3 to 5, which is broadly defined as middle to upper class, that utilise the private sector for family planning. And now I'll show a short summary of the primary research findings from the assessment. In terms of owning a health facility, to obtain a health facility licence, the facility must have a licensed physician on staff. Any facility that is not actually owned by a physician, and that makes up 82% of those surveyed here, as shown in the bar chart, all need to have a physician on staff. And this regulation places a barrier on the growth of private service delivery, given that there are such a small number of total physicians available in the country. To start these businesses, everyone uses their own money, borrows funds from friends and family. Not one person surveyed got a formal loan to start up their business, and this is really indicative of the lack of availability of formal financing for the health sector. I'll cover just a few points about service provision here. There's a lot covered in the private sector assessment report, and I'd recommend you have a look there if you're interested in knowing more. There is very little diversification of service offerings among facilities in this area, and one informant actually remarked on this in the interview. In terms of the availability of family planning services, at this point in time in 2019, facilities receiving a free range of commodities from the public sector, which actually also included family planning commodities. They would receive a small stock every so often in exchange for submitting their health data on time. The condition was that they offer the services and product 100% free of charge to the client. And in a moment, I'll walk you through how that impacts the facility's bottom line. For commodities in general, overall, the private sector supply chain was working well at that time, and few facilities reported regular stockouts. There were, however, reports that indicated severely constrained cash flow, which was creating artificial stockouts of commodities. Anecdotally, one of the reasons cited was that this was due to the lack of reimbursements for services covered by private health insurance, and I'll come back to that point in a moment. In terms of trainings, there's very limited support offered to the private sector by way of external trainings, and in-service trainings in-house are quite limited. It was reported that the Ministry of Health hosts trainings 1 to 2 times a year, and some places are offered actually to the private sector. But the places were reported to be offered to facility owners at last minute, and it was quite difficult for them to arrange someone to attend always. Now, the availability of some services was also limited in some cases due to the lack of electricity, and this was quite a challenge at the time of the assessment. Most of those surveyed were operating almost fully off generators, and to get a sense of what this costs, for a one-story clinic with a small number of consultation rooms, the cost to operate a generator is estimated to be around $20 US a day. Most of those